His life dream was to work for NASA.
The talent of Todd Crook's son, Chad, can be clearly seen in his designs of spaceships and other intricate artwork. What you can't see is the schizophrenia Chad was diagnosed with at age 20.
The disease progressed and progressed to where he had voices in his head constantly.
Despite what Todd calls a Cadillac health insurance plan, plus help and support from his parents and 3 siblings, Chad lost hope.
He saw what happens to somebody with prolonged schizophrenia and saw the people in the tents and the people on the streets. Well, we lost Chad to suicide on January 21st in 2016.
Soon after, Todd and his wife Laura began the Chad's Legacy Project to help other families. Experts say 1 in 5 people in the U.S. are dealing with some form of mental illness.
We realized that this is something much bigger than just a couple of parents talking about what happened to their son.
Todd helped establish the State Mental Health Summit, has led work groups, and has joined a steering committee to recommend changes in Olympia regarding children's mental health. Changes that he believes are underway in the 2019 session.
It's not fixed by any means, but it is kind of the start of something new and exciting.
So many of our people are suffering and dying.
One major change lawmakers are considering, the first bill Speaker Frank Chopp has been the prime sponsor of in 20 years, is to build a new behavioral health campus within the UW School of Medicine.
We have a huge workforce shortage in all mental health professions, including psychiatrists.
Doctors say the facility would provide some much-needed training, plus new treatment beds, for a state ranked 49th out of 50 for psychiatric beds in a 2015 State Institute for Public Policy report.
We have challenges there because we don't have enough capacity to be providing people what they need.
Representative Lori Jenkins of the 27th District in Tacoma says our system needs help at all stages, from the community level to civil commitments and criminal cases involving mental illness, too.
We have not done a very good job of investing in treatment for mental health.
Jenkins is working on a bill to respond to the True Blood lawsuit of 2014, where a federal judge ruled our state violated the rights of mentally ill patients by warehousing them in jails. Jenkins' bill calls for forensic navigators and other resources to help mentally ill people become competent to stand trial and ultimately stay out of the criminal justice system.
Charges will get dismissed on many of these folks because once their mental health is stable, they're not going to be doing kind of certain behaviors in community that cause them to be charged with crimes.
We got to get a handle on this.
Senator Keith Wagner of the 39th District in Cedro-Woolley says dealing with the True Blood suit and continued problems at Western State Psychiatric Hospital have pushed lawmakers to propose major changes to our state's behavioral health system.
Sometimes big problems like this warrant pushing the envelope of what we're familiar with.
Wagner, the ranking Republican on the newly formed Behavioral Health Subcommittee, says over the long term, Western and Eastern state hospitals should not be the primary options for mental health care. He says smaller, locally based facilities near a patient's family and support networks can provide better outcomes.
We want to put more resources in local communities so people are taken care of at the beginning of their need rather than waiting years and then being stuffed away in a big state institution.
Paying for these new facilities presents a challenge.
Thank you very much. You do some great work here.
While Wagner agrees with much of the $675 million mental health overhaul plan presented by Jay Inslee in late 2018, he doesn't like the capital gains tax the governor suggested as one way to pay for it. Along with using new state revenue coming in, Wagner supports a bill that would ask voters to approve the expansion of our state's bonding capacity to build new treatment centers quickly in the years ahead.
We can invest that money in the facilities to fix people, and I think it's a wise move.
It's one move of many by state lawmakers that has Todd Crook's attention this session. He's especially keeping an eye out on bills that would help young people.
Fact remains, we're still losing youth.
the state has been considering bills to mandate mental health education in our schools and help give parents more access to their teen children's mental health treatment.
It's a long game.
But it's unclear if the bills he's backing are still in play. Todd acknowledges he may not get everything he wanted this legislative session, but it's a start that gives him and thousands of other families in our state trying to tear down the stigma of mental illness some hope.
If the legislature does their job, then a year to 2 years from now, that will help a lot of the people like Chad.